Community health centers are medical centers that provide medical coverage to people who are underinsured or may lack access to medical coverage. WNCCHS has a sliding fee scale for patients who are underinsured or maybe lack financial means to pay for health insurance.
Community health is the kind of health that everybody should receive. We provide care for all. We look at all the needs of a person. So you can't have health care without attending to basic social determinants such as housing, transportation, food insecurity, safety. So I think community health from the very beginning of FQHCs acknowledged that people needed these other components to be supported in order to support their health. And I just think that we provide some of the best care available because we have resources and we talk about those things and we acknowledge that they're important for people's basic health. I also think, we serve everybody. We serve everybody no matter what. You can walk into the clinic and whether you're insured, uninsured, no matter what your background is, patients from all walks of life, we are here to serve the community and all people in the community. So that's really important to me.
The thing about community health is it's true medicine. We never know what we're going to get. We never know what people are going through. We have a lot of homeless in the community. We have families that are being displaced. And knowing that I make a difference in their life makes it worthwhile.
Everyone's going towards the same goal, if that makes any sense, in community mental health and community health in general. We're both just like, let's strive to make the patient the best, meet them where they're at. And I feel like everyone at WNCCHS understands that assignment. And so being in a pod environment is really nice as a provider because all the providers are within the same goal. You have medical assistants, you've got people you can ask questions to, especially as you're getting started. I love that there's behavioral health incorporated in, there's therapy services incorporated in, case management. All of those are things as a provider I used to have to outsource, right? And now it's all within one wheelhouse, and that's been amazing.
WNCCHS is special because we truly care for the patients and put their needs first. And we are a one-stop shop where people can get their primary care, dental care, behavioral health services, pharmacy, lab, all in one location, which is very convenient and provides truly integrated care.
Before I took this role, I only worked in mental health facilities. So mental health hospital or community mental health center or private mental health practice. And it is a night and day difference having a lab here, having immunology, having primary care around the corner, being able to consult and put together a fully integrated clinic. We're all one body. We've got the brain and the body, it's all one thing. And when people are not able to get connected to all the care they need, it was like working with one hand behind my back in the past. I would refer for labs and they'd never make it to the lab core, or I would refer for primary care and something would get missed and there would be no real handoff. But here, it's all here. We know each other. We can work together to make sure everything happens for these people. I have yet to meet a staff member who's not willing to help any patient, whatever their background, whatever their perspectives, whatever their troubles, and help me figure out how to put a good, safe plan together to get a patient the care that they need. And that's not everywhere.
I don't think you can go anywhere else and find the team that we have here. I am fairly new to the clinic, but I have never met a more dedicated group of individuals working under one roof. And from the pharmacist to the care managers to the MAs that we work with, the folks that choose to work here really want to be here. And I think that's what brings together solid teams of folks that are working with one focus in mind.
I think people who work here feel like it's a privilege to serve the patients that we serve. And that's not the same at all clinics.
Here, I belong. I'm getting emotional because
almost everybody here has different kinds of accent, different gender. You can be anything you want to be. You can be yourself. And if I am myself here, that's as far as my coworkers and my patients go. We can relate to each other. I do not have to sell dentistry. People want to come here. It's wonderful. I want to help those who want to be helped, and it's a wonderful feeling. But it's so much different from a private practice where you don't have a voice at all, and you cannot be yourself. You know, you have to try to really fit into this, short little kind of, little gates. But here, I feel like my patients are my friends. My coworkers are my friends. Nobody is judging me, and we are doing something really important for the community. We're taking care of people who otherwise wouldn't be taken care of anywhere. I like to make them feel comfortable, and that's why it's wonderful to work here.
I think the diversity, the equalization that we give all of our patients, no matter what they're dealing with, we have many resources to try to help in every aspect of their life, and they just become family. If you want to truly make a difference and you want to do what God has given you, come to WNCCHS. Be your best every day.